What is mechanical thrombectomy and its precision in stroke care? What exactly is mechanical thrombectomy and how does it play a role in stroke care? Mechanical thrombectomy is a minimally invasive procedure designed to treat ischemic stroke. This type of stroke occurs when a blood clot blocks blood flow to the brain. To perform this procedure, a small incision is typically made in the groin to access an artery. A thin catheter is then threaded through this access, point up to the site of the clot in the brain's blood vessels. Once the catheter reaches the clot, a specialized device, such as a stent retriever or aspiration catheter, is used to capture and remove the clot. This process restores blood flow to the affected area of the brain. Compared to traditional surgical methods, mechanical thrombectomy is gentler and less invasive, as it avoids large incisions and disruption of the skull. This procedure is usually performed by fellowship-trained neurosurgeons or interventional radiologists. They use advanced imaging technologies, such as fluoroscopy and neuroimaging, to precisely locate the clot and guide the instruments safely through the blood vessels. The precision of this technique is one of its key advantages. Timing is crucial when it comes to mechanical thrombectomy. It is most effective when performed as soon as possible, ideally within 6 hours of the onset of stroke symptoms. However, certain patients may still benefit from the procedure up to 24 hours after symptoms begin, provided that imaging shows salvageable brain tissue. Often, mechanical thrombectomy is used alongside intravenous clot-busting drugs, known as thrombolytics, but it can also be performed when thrombolysis is not sufficient or is contraindicated. The precision of mechanical thrombectomy allows for direct visualization and targeted removal of the clot. This significantly improves the chances of restoring blood flow compared to medication alone. By reducing brain damage, this procedure can lessen the severity of long-term disability caused by a stroke. The success of the procedure depends on careful patient selection, advanced imaging to identify those most likely to benefit, skilled operators, and timely intervention. Patients who undergo mechanical thrombectomy often have a better chance of regaining vital functions such as speech, mobility, and independence. This makes it a transformative option in acute stroke care. However, it is important to note that mechanical thrombectomy is primarily applicable to patients with large vessel occlusions and is not suitable for hemorrhagic strokes or clots in smaller vessels. In summary, mechanical thrombectomy is a highly precise and minimally invasive treatment for stroke that directly removes clots from the brain's arteries. When performed promptly by experienced specialists using advanced imaging guidance, it significantly improves outcomes, reduces disability, and can even save lives. Always consult healthcare professionals for personalized medical advice and treatment options.